The choice of the situation includes deciding to avoid or address a situation that is emotionally important. If a person decides to avoid or disengage from a situation that is emotionally important, the probability of feeling an emotion is decreased. Alternatively, if a person decides to approach or participate in an emotionally appropriate situation, the probability of feeling an emotion is increased. Typical situational selection examples can be used interpersonally, such as when a parent removes his or her child from a situation that is emotionally uncomfortable. In psychopathology, the use of situation selection can also be seen. For example, for those with a social anxiety disorder and avoidant personality disorder, the avoidance of social environments to control emotions is especially pronounced. A successful choice of the situation is not always a simple job. Human beings, for example, have trouble anticipating their emotional reactions to future events. Therefore, they can have difficulty making correct and rational decisions about which circumstances to handle or avoid, which are emotionally important. Situation modification. Modification of the situation requires attempts to alter a situation in order to adjust its emotional effects. Modification of the circumstance explicitly relates to modifying one's external physical environment. A cognitive alteration is called altering one's internal environment to control emotions. Injecting humor into a speech to evoke laughter or expanding the physical gap between oneself and another person can be examples of situation adjustment. Attentional deployment. Attentional deployment involves directing one's attention towards or away from an emotional situation. Distraction. Distraction is an early selection technique, an instance of attentional deployment which involves diverting one's attention away from an emotional stimulus and towards other material. Distraction has been shown to decrease the severity of unpleasant and emotional stimuli, to decrease emotion-related facial response and neural activity in the amygdala, as well as to relieve emotional distress. As compared to reassessment, when meeting stimuli with high negative emotional intensity, individuals display a relative preference to engage in the diversion. This is because diversion quickly filters out emotional material of high intensity, which would otherwise be relatively hard to appraise and process. Rumination. The passive and repeated focusing of one's attention on one's symptoms of distress and the causes and effects of these symptoms are known as rumination, an example of attentional deployment. In general, rumination is considered a tactic of maladaptive emotion control, since it appears to intensify emotional distress. It has also been related to a host of illnesses, including extreme depression. Worry. Worry, an example of attentional deployment, includes shifting attention to thoughts and images in the future dealing with potentially harmful events. Worrying helps to aid in the down-regulation of extreme negative feelings and physiological activity by concentrating on these events. While the worry may often involve problem-solving, incessant worry is typically considered maladaptive, being a prevalent characteristic of anxiety disorders, particularly generalized anxiety disorder. Thought suppression. Suppression of thinking, an example of attentional deployment, includes attempts to divert one's attention to other material, from real thoughts and mental images, in order to alter one's emotional state. While suppression of thought may provide temporary relief from undesirable thoughts, it may inevitably end up spurring even more unwanted thoughts to be generated. This method is commonly considered to be maladaptive, with obsessive-compulsive disorder most associated with it. Cognitive change. Cognitive change involves changing how one appraises a situation so as to alter its emotional meaning. Reappraisal. Reappraisal, an example of cognitive adjustment, is a method of late selection that involves reinterpreting an event's context in order to change its emotional effect. This may include, for instance, reinterpreting an occurrence by broadening one's viewpoint to see the larger picture. Reappraisal has been shown to minimize physiological, subjective, and neural emotional responsiveness effectively. In comparison to distraction, when meeting stimuli with low negative emotional intensity, individuals display a relative tendency to participate in reassessment because these stimuli are relatively easy to analyze and process. Reappraisal is commonly considered to be a technique of adaptive emotion control. Reappraisal can be associated with improved interpersonal performance and can be positively linked to well-being compared to suppression, including both thought suppression and expressive suppression, which is positively correlated with many psychological disorders. However, some researchers argue that when assessing the addictiveness of a technique, context is critical, indicating that reassessment may be maladaptive in some contexts. Distancing. Distancing, an example of cognitive shift, when assessing an emotional occurrence, requires taking on an autonomous, third-person perspective. Distancing has been shown to be an adaptive method of self-reflection, promoting the emotional processing of stimuli that are negatively valence, reducing negative feedback, emotional and cardiovascular reactivity, and growing problem-solving behavior. Humor. Humor has been shown to be an effective technique of emotion control, an indicator of cognitive change. In particular, it has been shown that optimistic, good-natured humor effectively up-regulates positive emotions and down-regulates negative emotions. In this regard, on the other hand, pessimistic, mean-spirited humor is less successful. Response modulation. Modulation of response requires attempts to explicitly influence the processes of experiential, behavioral, and physiological response. Expressive suppression. Inhibiting emotional gestures requires verbal inhibition, an example of response modulation. Facial expressivity, subjective feelings of positive emotion, heart rate, and sympathetic stimulation have been shown to be effectively decreased. The research results, however, are mixed as to whether this technique is successful in down-regulating adverse emotions. Research has also shown that verbal avoidance can have negative social effects, correlating with decreased personal interactions and greater relationship-forming difficulties. A maladaptive emotion control technique is commonly perceived to be vocal repression. It is favorably linked with multiple psychiatric conditions compared to reappraisal, associated with poorer interpersonal outcomes, is negatively related to well-being, and needs a reasonably large amount of cognitive energy to be mobilized. However, some researchers argue that when determining the adaptability of a technique, context is critical, indicating that repression can be adaptive in some contexts. Drug use. Drug use, an example of modulation of response, may be a way to change physiological responses associated with emotion. Alcohol, for instance, may cause sedative and anxiolytic effects, and sympathetic activation can be impaired by beta blockers. Exercise. Exercise may be used to down-regulate the physiological and experiential impacts of negative emotions, as an example of reaction modulation. It has also been shown that daily physical activity decreases emotional distress and increases emotional regulation. Sleep. In emotion control, sleep plays a part. Although stress and worry can also interfere with sleep. Studies have shown that in response to previous emotional experiences, sleep, specifically REM sleep, downregulates amygdala reactivity, a brain structure believed to be involved in the production of emotions. On the other side, greater emotional reactivity or overreaction to negative and stressful stimuli is correlated with sleep deprivation. This is attributable to the increased activation of the amygdala and the disconnection between the amygdala and the prefrontal cortex, which controls the amygdala by inhibition, resulting in an overactive emotional brain. Sleep deprivation can be related to depression, impulsiveness, and mood swings because of the resulting loss of emotional control. There is also some evidence that sleep deprivation can decrease emotional reactivity to positive stimuli and events and hinder the identification of emotions in others.